Stand in front of a pharmacy shelf and look at the eye drop section. There are dozens of bottles. Some promise to remove redness in seconds. Some require a prescription. Some are labeled for allergies. Some for dryness. Some for infections. They all go in the same place. So why are they so completely different? Here's what most people don't realize. Eye drops are not one product. They are 10 entirely different categories of medicine, each targeting a different mechanism inside the eye. And some of them, if used the wrong way, can actually make your problem worse. By the end of this video, you will understand exactly what each major type of eye drop does, why it works, and what is actually happening inside your eye when you use it. Your eye is constantly bathed in a thin film of tears, not just water, but a precise 3-layer structure. The innermost layer is a mucus layer that helps the tear films stick to the eye's surface. The middle layer is watery, carrying oxygen and nutrients. The outermost layer is oily, produced by tiny glands along your eyelids, and its job is to slow evaporation. When any of these layers breaks down, from screens, dry air, aging, or certain medications, the eye dries out. The surface becomes irritated. You blink more. Your eyes water, which feels like a cruel irony. Dry eyes that won't stop tearing. Artificial tears replace what's missing. Most contain ingredients like hyaluronic acid or carboxymethylcellulose, substances that mimic the watery layer and help the tear films stay stable. Preservative-free versions are packaged in single-use vials for people who need drops frequently, because preservatives used in multi-dose bottles can irritate the eye surface over time. These are the most commonly used eye drops in the world, and for most people, they are completely safe to use as often as needed. When your eyes turn red, what you're actually seeing is blood vessels on the surface of the eye, the conjunctiva, becoming dilated and filling with more blood. This happens in response to irritants, smoke, dust, chlorine, a poor night's sleep. Redness relief drops work through a class of ingredients called vasoconstrictors. Tetrahydrozoline is the most common one. These molecules bind to receptors on the blood vessel walls and cause them to constrict, to narrow. Within minutes, the red color fades. The eye looks white and clear. Here is where it gets interesting. Use these drops for more than a few days in a row, and you trigger a phenomenon called rebound redness. The blood vessels adapt to the vasoconstrictor. When the drop wears off, the vessels dilate even wider than before to compensate. Your eyes get redder. You reach for the drops again. The cycle deepens. What started as a cosmetic fix has become a dependency. This is why doctors recommend using redness drops only occasionally and never as a daily habit. In allergy season, the problem is completely different. When pollen, pet dander, or dust lands on the surface of the eye, immune cells called mast cells detect the allergen and release a chemical called histamine. Histamine causes itching, watering, redness, and swelling. Allergy eye drops contain antihistamines, molecules that block histamine receptors on the eye's surface before histamine can attach. Some formulas also include mast cell stabilizers that prevent the mast cells from releasing histamine in the first place. The critical difference from redness drops is that allergy drops are treating the immune mechanism itself, not just the appearance of the eye. They are safe for daily use during allergy season, and newer formulations can provide relief for up to 16 hours with a single drop. When bacteria infect the eye, as they do in bacterial conjunctivitis or pink eye, the immune system responds with inflammation, discharge, and crusting. Antibiotic eye drops deliver antimicrobial agents directly to the infection site. Common examples include tobramycin, ciprofloxacin, and erythromycin. These drops work by targeting structures unique to bacterial cells, their cell walls or their protein-making machinery, causing the bacteria to die or stop reproducing. Human cells don't have the same structures, which is why the drops are selective. But here is a common mistake. Antibiotics do nothing against viruses. Most cases of pink eye are viral, not bacterial. Using leftover antibiotic eye drops on a viral infection or on an eye that isn't infected at all doesn't help and contributes to antibiotic resistance. A proper diagnosis matters. Inflammation is the eye's response to injury, surgery, autoimmune conditions, or severe infection. The immune system floods the area with inflammatory signals, causing swelling, redness, and pain. When this inflammation is severe or persistent, it can damage the tissues it's supposed to protect. Steroid eye drops, containing molecules like prednisolone or dexamethasone, suppress this inflammatory response by interfering with the signaling pathways that drive it. They are some of the most powerful tools in ophthalmology. But that power comes with real risk. Prolonged use of steroid eye drops can raise pressure inside the eye, which can damage the optic nerve. It can also accelerate the formation of cataracts, a clouding of the natural lens. This is why steroid eye drops are only available by prescription, prescribed for specific durations and monitored carefully. These are not ordinary drops. They are targeted anti-inflammatory drugs that happen to be delivered through the eye. Inside the eye, a fluid called aqueous humor is constantly produced by a structure called the ciliary body. It circulates through the front chamber of the eye and drains out through a tissue called the trabecular meshwork. This cycle maintains a stable pressure inside the eye. In glaucoma, this drainage becomes impaired. Pressure builds, and high pressure compresses the optic nerve, the cable that carries visual information from the eye to the brain. Over time, without treatment, the optic nerve is damaged and vision is lost, often silently, from the edges inward. Glaucoma drops work either by reducing how much fluid is produced or by increasing how efficiently it drains. Common classes include beta blockers, prostaglandin analogs, and carbonic anhydrase inhibitors. These drops do not restore vision that is already lost, but used every day without fail, they protect the vision that remains. For millions of people worldwide, a single eye drop each night is the difference between sight and blindness. Standard artificial tears replace the surface layer of tears. But for some people, the problem goes deeper. In chronic dry eye disease, the lacrimal glands, the structures that produce the watery component of tears, become chronically inflamed. The inflammation suppresses tear production. Less fluid is produced. The surface dries. The drying causes more inflammation. The cycle continues. This is where prescription dry eye drops intervene differently. Cyclosporin, marketed as Restasis, is an immunosuppressant that reduces inflammation in the lacrimal gland tissue itself, gradually restoring the gland's ability to produce tears. Lifitegrast, a newer option, blocks a specific inflammatory pathway called the integrin-ICAM interaction. These are not lubricants. They are not masking symptoms. They are treating the inflammatory cause of the disease. They typically take 3 to 6 months to show full effect, which is why patients sometimes stop too soon. When your eye doctor places drops in your eyes during an exam and tells you your vision will be blurry for a few hours, this is what's happening. Dilating drops, typically tropicamide or phenylephrine, work by blocking the muscle in the iris that controls pupil size, or by stimulating the muscle that opens it wider. The result is a pupil that expands to its widest diameter. This allows the doctor to see deep inside the eye, the retina, the optic nerve, the blood vessels, in far greater detail than a normal-sized pupil permits. The blurry vision occurs because a second muscle in the eye, the ciliary muscle, which controls the lens shape for close focus, is also temporarily paralyzed. Some dilating agents can keep the eye unable to focus for 24 to 48 hours. This is useful when checking for certain conditions in children, but it's an important thing to know before your next eye exam. Beyond these major categories, there are several more targeted options. Antiviral drops like trifluridine treat herpes simplex infections of the cornea, a serious condition that can permanently scar vision if untreated. Antifungal drops, less commonly used, treat fungal keratitis, often seen after an eye injury involving plant material. NSAID eye drops, similar to ibuprofen in mechanism, reduce inflammation without the steroid risks and are often used after eye surgery or for certain corneal pain conditions. Contact lens drops are specifically formulated to lubricate the eye while a lens is in place, using ingredients compatible with lens materials. And lubricating gels, thicker than drops, provide longer-lasting moisture for severe dryness, though they temporarily blur vision, making them better suited for nighttime use. So go back to that pharmacy shelf. You now know what you're looking at. There is no such thing as a generic eye drop. There is a lubricant, a vasoconstrictor, an antihistamine, an antibiotic, a steroid, a pressure-lowering drug, an immunosuppressant, a diagnostic tool. Each one is designed for a completely different problem, targeting a completely different mechanism inside the eye. The next time someone hands you an eye drop or reaches for the nearest bottle, the right question is not which one clears it up fastest. The right question is, what is actually wrong with the eye? Because now you know the difference.